Welcome to the deep dive. Today, we're really digging into what it takes to spot truly effective leaders in a super critical field, healthcare, and specifically the nursing supervisor role. We're drawing on a pretty comprehensive guide here, one designed to help hospitals and clinics find that, perfect fit for managing their nursing teams.
That's right. And our goal today really is to unpack the kind of interview questions that get past just the clinical skills. We want to understand how to probe for leadership, for problem solving, for team management abilities. And look, this isn't just about nursing supervisors, is it? It's kind of a masterclass in spotting leaders who can handle high-pressure environments, period. We'll look at how these questions are designed to reveal, well, deep knowledge, sure, but also that ability to perform when things get tough and, crucially, the potential to grow.
Exactly. Think of this as maybe a shortcut to grasping just how complex this job is and the thought that goes into finding the right person. We'll explore questions aimed at identifying someone who's not just a skilled RN, a registered nurse, but who also has that extra layer of healthcare management training or experience. So yeah, if you're interested in leadership, healthcare, or just how you find talent when the stakes are high, stick around. This should be pretty insightful. Okay, before we get into the questions themselves, let's maybe unpack the role a bit more. What does a nursing supervisor actually do all day? It sounds like more than just, managing shifts.
Oh, definitely. I mean, at its heart, it's about patient health, promoting it, restoring it. But they do that through, let's say, strategic oversight. So, yeah, there's the day-to-day management of care, making sure everything runs smoothly now. But there's also the longer-term planning for the unit or department. It really demands this unique blend. You need the sharp clinical background, absolutely, but also really solid management skills. And the questions we're talking about, they're specifically built to find people who have both that team management knack and the problem-solving chops. And like I said, performing under pressure. That's key.
And the guide we're looking at points out these questions shouldn't be like off the shelf, right? They need tailoring.
Exactly. Customization is important.
That really speaks to how varied the role can be. Maybe one place needs someone strong on recruitment, another needs expertise in, I don't know, budget management or specific record-keeping systems.
Precisely. It's not one size fits all. You tailor it to the specific needs, the culture, the challenges of that particular unit or hospital.
Okay, makes sense. So, with that complex role defined, where do we start? The guide kicks off with operational and situational questions. Sounds like testing their thinking on the fly.
That's exactly it. These are designed to see how a candidate handles, well, real-world stuff that pops up unexpectedly. It gives you a window into their practical judgment, their approach to solving problems, when there isn't a clear answer in the rulebook. It's less about what they know, more about how they apply it.
Gotcha. So what are some examples? What kind of scenarios are we talking about?
Okay, well, you get questions like, what would you do if a nurse just wasn't following your instructions?
Yeah. Test authority, but also maybe diplomacy.
Right. And
What-
conflict resolution.
Right.
Or how do you handle conflicts between team members? Super important for keeping a team working together.
Yeah, that can derail things quickly.
Totally. Then there's how do you evaluate your team's performance? This gets into their leadership style, how they develop people. And related to that, if a nurse is underperforming, how do you address it? And how do you try to motivate them? That's a big one. Constructive feedback is tough.
Definitely. What else in this category?
Well, you also want to ground it in their experience. So
Yeah.
what clinical experience has been particularly important or relevant to you? Just making sure that foundation is solid and informs how they'd manage. Also, how do you keep up with changes in the field? Healthcare changes so fast, you need lifelong learners.
Good point.
And finally, something like, what do you hope to gain from this position? This can tell you a lot about their motivations, where they see themselves going. The thing about these questions, it's not just about the answer. It's seeing their thought process, seeing if they stay calm, if they're considering different angles. It's about that adaptive intelligence, really.
Adaptive intelligence. I like that.
Right.
Okay, so after testing that on-the-spot thinking, the guide moves into role-specific questions. This sounds like we're getting down to the brass tacks of the job itself.
Yeah, exactly. These questions are really targeting the direct experience, the specific skills needed for this supervisory role. We're making sure they actually have the tools in their toolkit for the day-to-day management stuff.
Okay, so what kind of specifics are we zeroing in on here? Is there anything that might seem, I don't know, small but is actually vital?
Good question. So you'll see things like, tell me about your experience in training, supervising, and evaluating staff. Pretty direct, right? Assessing that core management background.
Straightforward.
Then something more nuanced. How do you manage newly trained nurses differently than, say, very experienced nurses? That shows adaptability, mentorship skills.
Ah, okay. Recognizing different needs.
Exactly. Also, what kinds of patients did you typically care for as a nurse? Understanding their clinical background, their comfort zone. And here's one that answers your question about small but vital. How would you rate your computer skills?
Ah. Yeah, you wouldn't necessarily think of that first.
Right. But think about scheduling, electronic health records, reporting, maybe even budgeting software. It's actually crucial for the administrative side, which is a big part of the job. You also want to know, how would you report updates or issues to the nursing director? Checking their understanding of communication lines, the hierarchy.
Makes sense.
And this one's important. Are you comfortable stepping in and taking on direct nursing duties if needed, like during a staffing crunch?
Shows commitment, willingness to roll up their sleeves.
Definitely. And finally, a really interesting one. Do you think nursing skills or management skills are more important for this role?
Ooh, that's a tough one. A philosophical question almost.
It is, and it probes their understanding of that unique balance we talked about. The truth is, for this specific role, you really can't separate them. Clinical credibility gives weight to their management decisions.
That blend again. Okay, that really clarifies the specific demands. So the final category is behavioral questions. These are the tell me about a time when questions, right? Often seen as good predictors.
Absolutely. Behavioral questions are powerful because they ask for specific past examples. Instead of asking, what would you do? It's, what did you do?
Mm.
This lets you assess soft skills, resilience, problem solving based on actual past actions, not just theoretical answers. It's about showing, not just telling.
Okay, so give us some examples here. What kind of past experiences are we asking about?
Well, these really dig deep. For instance, tell me about a particularly difficult case you handled as a nurse. And importantly, how would you use that experience to train your team to handle similar situations?
Ah, so it links their past clinical experience directly to their future role as a trainer or mentor.
Precisely. Or give me an example of a time you improved efficiency in clinical operations.
Hmm.
Were they proactive? Did they make a tangible difference? How about this? Tell me about a time one of your staff members received a less than positive performance review. What did you do next?
Yeah, test how they handle difficult conversations and follow up. Do they help the person improve or just deliver the bad news?
Exactly. And this one's critical. Describe a time you were significantly short-staffed. How did you ensure patient care standards didn't slip?
Wow, yeah, pressure cooker situation, patient safety on the line.
Absolutely. You also need to know, how do you handle highly emotional family members? Tests empathy, communication under stress, crisis management, and a classic. Describe a really stressful situation you faced and how you managed to stay calm and effective through it. Assessing that emotional regulation, that ability to lead when things are chaotic.
It seems like the real power here is getting concrete evidence, not just aspirations.
That's it, exactly. It's the predictive nature. Past behavior is often the best indicator of future behavior. These questions force them to draw on real experiences, which gives you a much more reliable picture of their actual capabilities and, frankly, their character under pressure.
So, wrapping this all up,
Yeah.
what's the big takeaway here for someone maybe thinking about leadership or interviewing or even just trying to understand these critical roles better?
I think what's really striking when you look at these questions together is just how clearly they map out the complexity of this job. It's so much more than just clinical skill. It really highlights this deeply human skill set that's required. Leading, mentoring, resolving conflict, staying calm, advocating. It's huge.
Yeah.
And if you zoom out, it kind of underscores that great leadership, really in any demanding field, it comes down to mastering both the technical side and the interpersonal side. You need both.
Yeah, that really comes through. It's not just what you know, but maybe even more importantly, how you lead, especially in a role like this. The blend is everything.
Precisely. Which maybe leaves you with something to think about. In your own world, your own experiences, where have you seen that combination, that technical skill plus real empathetic leadership make the biggest difference? Maybe in a way you didn't expect. And how does understanding the layers we talked about today maybe change how you see certain job titles, or even think about your own contributions or leadership style?
Definitely something to chew on. We hope this deep dive gave you some valuable insights, maybe sparked some new questions. Until next time, keep digging deeper.